Hi, YouTube world. This response is to Brittany, who says, as a checkpoint for Prometric, number 19 says to replace basin water if it becomes soapy or cool. And she asked, can we just say we would replace it if it did, or do you actually have to replace it, or whatever? Well, for the test, you present the test exactly like you would in a clinical setting. So if the water gets soapy or cool, then you would have to replace it during the test. You wouldn't just say that you would. So that's kind of point number one. But point number two, I want to talk about the specifics there. First of all, the basin should not get soapy. Basins are no soap zones. We don't put soapy items back in the basin. There should be no soap in there. So soapy, kind of push off to the side. We should not have soapy. But cool is a possibility. If you don't work quickly, that water can cool down. And I want you to think about it from the patient's point of view for just a second. Imagine somebody is bathing you. You're laying in bed, covered by a privacy blanket. It's probably cold. Somebody is bathing you. Now, you definitely don't want to be bathed with cold water because that would be very uncomfortable. So you want to make sure that the water is warm enough to keep the patient comfortable, but you do want to kind of move along as you bathe. You don't want it to take a long period of time. So this is where that practice kind of comes in. The more you practice a skill, the faster you get at it, the more comfortable your patient will be because they're going to be dry quicker. So the biggest part of this is just to practice that skill enough that you're comfortable enough with it that you can perform it relatively quickly. That way the water doesn't cool down and this won't be an issue. But for the test, remember, basin's no soap zone, so it won't be soapy. But for the test, if that water does start to cool down, when you put your gloved hands in there, if the water feels cool to you, the patient's definitely going to be uncomfortable. So take the time to change it out. I hope this helps. Thanks for the comment, and let us know if we can be of further assistance. Bye.